Hi everyone, this is going to be a short video just to go over some basic body mechanics so that you can save yourself, so that you're not opening yourself up to some repetitive strain injuries, as well as learning how to leverage your body weight to get the pressure that you need for the techniques on your client, so you're not having to rely on brute strength. Okay, now there are a few different approaches to body mechanics. I'm just going to go ahead and undrape my client and I'll demonstrate those approaches for you. Okay, so the first one that we're going to look at right now is the martial arts approach. Okay, so these ones have three basic stances. First one is if you're going to be facing the table to your client, you want to make sure that your feet are square to the table, you're facing the client, and you're very grounded. Okay, so visualize your feet almost projecting down into the ground so that you feel very stable, very grounded. Then what you'll do is any of the techniques, say you're doing ringing or if you're doing C-scooping, you're facing the client and your body's in a really great position. Okay, and then you can basically go back and forth. If you need to put any pressure in, you've got a nice stable stance that you're working from and then pushing into the client. Okay. How that would look from the other side. I'm square facing the client here so that if I'm doing, say, the C-scooping, my legs are a nice wide stance, and then I'm going back and forth. Okay, so for my C-scoops, ringing, this way your joints are basically in the optimal position so that you're not cranking yourself in an uncomfortable position. Okay, so that's the first stance in the martial arts approach. Okay, you can use that even when you're at the head of the table. Your feet are square. If you're doing any nice strokes going down the back from this vantage point. Now you need to make sure even when you're in this position that your legs are spread nice or about shoulder width apart. Make sure your knees are soft, okay? You don't want to have hyperextended knees. So your knees are nice and soft. And then when you're pushing your strokes through, to make sure that everything is straight. So your forces are basically going straight through the joints themselves, through your wrist, elbow, and shoulder, okay? This way you get better force into the client, and it's also a lot easier on your joints, okay? So when you're pushing, you're basically leaning your body weight forward. My knees are slightly bent, and I'm moving down this way. Okay, I'll show up a little bit of oil. It's nice and smooth. See, my knees are bent, and I'm basically leaning into the client using my body weight for pressure. And you can see the force is basically coming up through my hand. It's going straight through my wrist joint, straight through my elbow joint, and then up into my shoulder. The worst thing you can do is to not have that force going straight through those joints. So say your wrists were cranked out to the side, you're going this way, it's going to be really, really hard on your wrist joints. And it's going to interrupt the force that you're using from you into your client, okay? Another position can be if you go ahead and you're kind of in a half lunge, okay? So you've got your feet placed in the force of the direction that you want to go. And so this way, as you're moving through the actual stroke, you're bending and lunging at the same time, okay? So same thing, the force is coming from my body straight through all of those joints in a nice linear fashion, but the actual motion is not coming from my upper body, it's coming from my lower body, okay? So I'm moving through a nice lunge. This way, all of my strength is coming from my lower body. Lots of therapists, they just stand still. They might have hyperextended knees, and they're bending at their back and using the strength of their arms. This is going to get exhausting. Your low back is going to get sore, and your legs and knees are going to get sore as well. If you keep that nice lunging pattern, I have an easier time getting my body weight and using that force into my client. And this you can go if you're at the top of the table as well, and you're moving down just on the one side, making sure you're in that lunge pattern. And you're moving through. Okay, so that's looking through the martial arts approach. Then there is something they call a leaning approach. I use a combination of all of these when I'm actually going through my treatment. Leaning is if I'm really trying to get the focus of my pressure in on a specific technique. Okay, so say I've gone ahead and I'm moving through some nice deeper strokes and I find a trigger point. Okay, and I want to do that ischemic compression to try to get that trigger point to relax and melt. Then what I do is, so say I found an area right in his erectors here, okay? And I'm going through and he's like, oh, that's sore in there, and I feel the pulsing. So what I do is I actually go ahead and I'm going to lean. So all my pressure is leaning in on the client. So basically right now, if the client was taken away and this table was taken away, I would fall over, okay? I'm putting my body pressure into this lean, okay? You can do that from the front end as well. Say I found something up here that I really want to go ahead and put my pressure in. I'm leaning. I'm pretty much got all my weight on my left foot here, and I'm leaning. Again, if he was taken away and the table was taken away, I would topple forward. All of my body weight is being forced into my pressure, into the client. So using a combination of the martial arts and the leaning approach is really great. Practice, play around with it. Biggest thing is always making sure that your back is straight. When you're moving, you don't want to be bending at the waist because that is going to cause some low back problems. You're always moving through a lunge pattern so that your back is staying straight and you're moving through your pelvis, okay? You don't want to be having to use your upper body all the time to move and bending at your back. That's going to cause repetitive strain through any of your upper arm joints and your low back. So you're always keeping that low back straight, always engaging your core, and then lunging and squatting through. Always keep your vector of force going straight through your joints so that you're not putting pressure on them at an awkward angle. Okay, that's body mechanics in a nutshell. Thanks.